What's up, Michigan? My name is Lorne Plant. I'm the executive producer along with the vice president of operations for State Champs Network, and it is my sincere pleasure to be with all of the Above the Net podcast fans. Injuries, specifically in volleyball, as we all know, is just part of the game. It's how you deal with them that literally could be a game changer. Joining me is Dr. Brandon Kakos. He is a Detroit Medical Center orthopedics and sports medicine physician and is board certified in pediatric sports medicine. Welcome to the show.
Thank you. Thank you for having me.
Great to be here. All right. Before we get into our topic here, you grew up in the Metro Detroit area. You were a multi-sport athlete throughout your life. And maybe what impressed me the most is the fact that not everything you've accomplished in the medical field, which is a lot, but the fact that you have run 3 Boston marathons, that always blows me away.
Yes, that was a long time ago, but that was one of the best experiences of my life. I'm sticking to 5Ks right now. I got 5 little ones. So 5 little ones training for a marathon. Sometimes that can complicate things, but 5Ks are the perfect race. But yeah, the Boston Marathon, that was one of the highlights of my life right there for sure.
Absolutely. Quickly, what drew you to sports medicine as a profession?
Yeah, I think because I grew up playing sports, literally 3 sports in high school, I knew I always wanted to do something that intertwined my love for sports with my passion kind of for science and medicine. And so sports medicine just was a very natural fit for me. And I always tell even the people that I train under me, you always want to find, the disease processes, the patients that you interact with on a daily basis, that you can see them for 50 years, however long your career is going to be. And every day that I go to work, I know it's a cliche thing to say, but I truly enjoy it. I enjoy interacting, getting to know all of our patients, getting them back to doing what they want to do, which is, my main goal. So it's been very, very fulfilling so far.
Absolutely. Hugely gratifying when someone, you see them from the beginning, that maybe despair, and maybe not sure what the injury is, how long they'll be out, whatever. And then obviously back to gameplay is certainly euphoric. So we're talking volleyball. What are some of the common volleyball injuries that you see in your practice?
Yeah, so in my practice, I think if we just kind of go down a little bit, ankles, we see ankle sprains, some looseness in the ankle, we call it laxity. The knee injuries, ACL, which is the anterior cruciate ligament, is a very important stabilizing ligament for the knee. Patellar tendonitis, some issues with the kneecap as well. With your low back, so back strains, back spasms, and even stress fractures. Finger sprains, finger dislocations. But the overriding thing that's kind of interrelated between all of them is really overuse. And so overuse is when you kind of perform the same activity over and over again and not really giving your body and your joints and your muscles and your ligaments a chance to kind of rest and recover. That's what kind of predisposes you to getting injured. And so I always preach this a lot with the patients I see on a daily basis, right? We want to make sure that we're increasing the intensity of our activity, how hard we're going, the duration, how long per day, and the frequency, how many times per week, at an appropriate level to allow your body to acclimate to that load. If you don't do that, that's what predisposes us to getting injured. And that's kind of an overriding thing. And even prior to the pandemic, we were seeing overuse injuries, but obviously I think that accentuated it when there was interruptions in play and we all wanted to get back to kind of our pre-pandemic level of activity. And so sometimes we just have to be very mindful not to do that too quickly, too fast to give ourselves the best chance to be injury-free.
Yeah, absolutely. And volleyball, their season will be entering into the postseason. It's already been a long grind. They started in August. So these are the moments where, you might see some, your body might break down a bit. Unfortunately, injuries do happen. Now, one of the things that I always love about doing high school sports, as we have for the last 20 years, we always are introducing ourselves to a new audience. And there are new athletes that maybe haven't been at a level that has been this active. Maybe they were more of a recreational athlete or just something not as intense as maybe at the high school level. And injuries happen. And ACL injuries are something that a lot of athletes have to deal with it. And I'm sure when it happens, they ask themselves right away, is this considered a season or even a career-ending injury?
Absolutely. There's a lot of fear surrounding that, right? We hear a lot of most people generally hear about ACL injuries and a lot of our professional athletes, and they see the recovery that they have to go through. And so that's why their initial reaction right after is, whoa, what just happened here? And, what am I facing? And so the vast majority of ACL injuries will not be career ending, but can't really make a blanket statement with that outside of, are there any other injuries outside of the ACL, right? The ACL is obviously one that we're focusing on, but, you have the meniscus in your knee, cartilage, other ligaments. That'll determine your kind of treatment course and overall recovery. So generally, because volleyball, the stress being placed on the knee, remember it's a stabilizing ligament, and the jumping,
Right.
the cutting, the serving, you really need a functioning ACL there to perform at your peak. So generally, they do require, probably a loss of the season, but they're not career ending. But again, like I said, it has to be individualized. Not everyone's going to have just the same run of the mill ACL tear there, and even where, and so that's why it's really important to ensure that there's no other compounding injuries.
Absolutely. And one of the things that always, fascinates me is that the statistics that show that women are at greater risk for ACL injuries than men. If you could explain that quickly.
Yeah, there's a lot of active research poured into this, and it's been 10, 15 years. A ton
Right.
of studies looking into that very because we know, yeah, sometimes up to 2 to 4 times more likely than men. And I think the answer is multifactorial, meaning it's not just one reason why. I think there's a lot of theories out there. A lot of them center around, the anatomical differences, our pelvis shape, some strength differences, not necessarily strength differences between men and women, just individual within our muscle groups, our hamstring, our quads. Sometimes when women tend to be a little stronger in the quad than the hamstring, and that all shifts the forces being felt by the knee. So it goes back to that overuse that I was saying as well. Anytime there's a biomechanical change potentially or the force being felt by that knee, and if it's too quick, too sudden, it can lead to a tear. Now, there are also some theories about some hormonal differences leading to a little bit looser ligaments in females than males, and so that's why a prevention program. We're really trying to get this before it really manifests, and so it's really critical. There's some tests that we can do even in the office prior to even getting an injury, or even something maybe an athletic trainer or a coach can look into, and to really ensure that some of these young female volleyball athletes are doing a prevention program to prevent this from happening.
And there's a lot of techniques and methods that you can do that sometimes don't require surgery for a knee injury.
Absolutely, absolutely. I would say the vast majority of knee injuries do not require surgery. It's a very
Okay.
small subset that are going to require surgery. So yeah, the great majority of patients that I see with knee injuries from volleyball are not going to end up needing surgery.
All right. That's always good news. Uh, we talked about overuse,
Yep.
and a lot of people tend to play a variety of sports. So cross training is
Yes.
something that is prevalent. How does that play a role in reducing injuries? Because we're seeing more and more, even at the college level, coaches want their athletes to be multi-sport athletes.
Exactly. And it goes right back to what we were saying before about overuse, right? Just because you're not playing volleyball every single day doesn't mean that you have to just sit at home and do nothing. That's where you can take advantage of recovery, rest, utilize some other muscle groups that you don't normally engage while you're playing volleyball, which will only make you a better athlete, will improve your anticipatory, ability to hit the ball, to improve your reflexes, your reaction time. Those are all things that on the surface you may see, why am I doing this? I'm a volleyball athlete, but in reality, they're only going to make you strong. And it's hard to implement because sometimes, yeah, there are some people you're only going to get better if you continue to do this over and over and over again. And
Right.
yeah, I think finally starting to get this paradigm shift to say, you know what, we need to really focus on recovery, and that goes into another area that I always try to preach. It's that gets overlooked. We all tend to know it. The hydration, the nutrition, sleep. Those are all things I always say. Sleep's a performance enhancing drug, and we don't all take advantage of it. But those are all things that can really go a long way in reducing injury, and cross training is definitely paramount. So I think we're finally starting to get that message out there. But the more we can do that, yeah, people need to realize there are so many other ways and other things that you can do that will only make you better at your sport.
That's right. And that's what we're doing here, spreading the word.
Very
Joining me
good.
is Dr. Brandon Kakos. He is a Detroit Medical Center orthopedics and sports medicine physician. And I've got one more question for you. And when is an injury something that you can treat at home? When is it time to see you, a sports medicine or orthopedic specialist? How do they know
Yeah,
that?
that's so big thing. Not all aches and pains require evaluation by a physician or a health professional. So I always tell people kind of the things that kind of pique my interest a little bit more. If you're having really a hard time walking, if there's progressive swelling, if there's any numbness or tingling or any temperature changes, obviously in the hand, the feet, or anything that's just not getting better with what I consider a more conservative treatment, that's when you need to get checked out. The sooner you identify the problem, the sooner we can individualize that treatment plan to get you back to playing. No one likes going to the doctor. No one likes having to take time off from their sport. But at the same time, quick identification leads to quicker recovery, quicker implementation of those treatment strategies that can get you back to playing. But at the same time, like I said, I think there are certain things where you can just let things kind of unfold as long as those red flag signs aren't there. And then if it's not getting better, more than happy to see you.
All right, I want to thank Dr. Brandon Kakos for joining us today on Above the Net. If you have a sports injury keeping you sidelined, call the orthopedic and sports medicine team at the Detroit Medical Center. You can call them by calling 1-888-300-DOCS. Super easy, 1-888-300-DOCS or 3627. And please check out all our terrific DMC Game Changers videos with Laura Ramos. Thank you.